The objective of this tape is to teach you a method of examination of the lame horse. The lame horse often confuses the student in his first examinations, and I'm going to try to give you a standardized method of approach that will be helpful to you. Keep in mind that more than one thing can be wrong with one leg. Also keep in mind that more than one leg may be lame. If you forget these possibilities, you're going to be embarrassed sometime. Even though you find an obvious change in a limb, be sure you look for less obvious things that may be wrong. You might find a horse with an enlarged carpus that had been that way for years and was not causing lameness, and you might miss a nail in his foot. The use of your eyes, of your ears, and of your sense of touch are very important in examination of horses. Learn to train your eyes to look for the changes that we're going to demonstrate. Use your ears to hear the differences in sound as the feet hit on a hard surface. And use your sense of touch to detect swellings and heat changes in the limbs. This means that you must know the normal of all of these things before you can know the abnormal. And you should practice on every horse that you get an opportunity to develop these senses. Now, a lameness might be a swinging leg lameness, meaning that it will show lameness during motion, or it might be a standing leg lameness, meaning that it shows lameness as the horse bears weight in a standing position. And some lamenesses will show both of this type, and both swinging and standing leg lameness. We'll now go to the movie to demonstrate the lamenesses of a forelimb and a hind limb. You must be able to detect which leg is lame before you can start your examination. And so our emphasis on the first part here will be for you to learn how to decide which leg is lame. Now let's watch this first sequence on this horse. There you can see a lameness in the left foreleg. You saw the horse stumble. Now I'm going to back that sequence up and we'll go through it in a slower motion. Now what I want you to watch for here is watch the head and body rise as the affected limb hits the ground. As this left fore hits the ground, watch the head and body rise, and when he lands on the sound right foot, watch how the head goes down and the whole body weight comes down. So head up, body up on the unsound limb when the forelimb is lame, and head down, body down when they land on the sound limb here. Other things to watch for is how the foot lands. A horse will modify his weight and the way he lands with the foot depending on where he hurts. This particular horse is landing toe first. In the normal animal, the heel lands slightly before the toe. But if he has a nail in the medial aspect of his sole, he'll try to carry the weight first on the lateral aspect of the sole. If there's a painful area on the medial part of the sole, he'll carry the weight laterally. And so on. If there's a painful area in the toe, he'll try to carry the weight on the heel. If it's painful at the heels, he'll try to carry at the toe. In this case, he's more painful toward the heel area, and he tries to land on his toe. It means that he will modify the anterior and posterior phase of the stride. If this were a line down here representing the halfway mark in the stride, this portion of that would be the anterior phase, and this portion of the stride would be the posterior phase. And they'll modify the anterior or posterior phase according to where they hurt. In this case, the anterior phase of the stride is shorter than normal. Now you see passing over the affected limb. Now watch the weight drop. There. Head down. and body down on the sound limb. Now, push off, look at the head rise, body up as we pass over the unsound limb. And now as the sound limb comes forward, watch the head and body come down as the right foot lands. This is how a forelimb lameness is detected. Also note that the hips will stay relatively even, and we'll show this again so you will not confuse a hind limb with a forelimb lameness on the lateral view, and I'll show you on the lame hind limb why that could happen. Let's watch this through a little bit faster. Weight down. Head up. Head down. Unsound. Sound. Unsound. Sound. Now the more lameness there is in the limb, the more the weight changes will be obvious. Now also look for standing changes. Here the horse is pointing with the affected limb to relieve pressure in the navicular bone area on the back of the fetlock. In this case the horse has navicular disease, but there are other things that would cause him to do that. He relieves pressure on the back part of the foot between navicular bone, deep flexor tendon, at the sesamoid bone area, flexor tendons, so it's not always navicular disease. But that's called pointing, and he stands with that foot forward. Now as the horse moves, also watch things like fixation of the shoulder joint. This lameness is often confused with lameness of the shoulder, and in lameness of the shoulder, this joint is fixed. There's very little motion between the scapula and humerus. And in this case, you'll see that that's not true. There's free motion in that joint. Now watch this sequence again. Up on the unsound, down on the sound. Up, down. So the left forelimb is unsound. This is the, watch the hips. The hips stay relatively level. And when we get to the lame hind limb, you'll see the difference. Sound, sound. Now we are going to look at the lame hind limb. We'll watch it first so you can see the sequence on it. See if you can decide before I tell you which leg is lame. And I'll back that up. Let's watch it at a slower sequence. Now, watch the left hind limb elevate the hips so that the unsound limb can advance with a minimum amount of flexion. Now, push off with the right one, pass over the top now on the right unsound limb. Now as the body weight comes down, they're landing hard again on the sound left hind. Now they push up with this sound limb and they elevate the hips, pushing this hip somewhat higher than this one. But these muscles tense the gluteal region and often give you the impression that this hip is higher, but it's because the muscles are bunched and tense from the push off on this limb. This is the unsound leg. Now let's watch it with that in mind. Landing down the sound left, push up with that left, advance that other one with a minimum amount of time on the ground and pressure on the limb. Push up with the left, and now we'll move that a little faster so you can watch it again. Now let's watch this sequence in slower motion. There's a good picture there of elevation of the hip, pushing up here with this leg, bunching of the muscles to raise this hip as high as possible to advance this limb with a minimum amount of flexion so that we can be a minimum amount of weight placed on it as it goes by. And then the weight dropping in hard on the sound left hind limb. Push up, take the weight as short a time as possible, land hard. Push up, and land hard. Elevation of the hip with the sound limb, passing over the top and landing hard. So as that foot sinks in, if you were listening to this, as this foot there hits the ground, you would notice that it makes more noise than when this one hits. This makes more noise because the weight comes down. That is the sound one that makes more sound. And that it would also be true in the forelimb. As it came in on the sound forelimb, it would make more noise than it would on the unsound one. Now we'll show it the faster speed. Push up and land hard down. Up, down. That's the sound limb. I'm putting more stress here on the hind limb because you see fewer of them, and most people have more trouble diagnosing hind limb lameness because they see fewer of them. So we'll try to get these principles well embedded in your mind. Now from the side view, first we'll go through at a regular speed. You'll see probably that there's some difficulty there for you. Now, watch it at a slower motion. Landing down hard now on the sound left hind, and you'll push up. There you can see the elevation of the hip. Now coming down on the sound one, push up, and then it'll settle down on the sound one again. Now the hips will go down right there. You can see the settling of the animal right there. Now, this means that on the side view in a hind leg lameness, there's considerable more up and down motion of these hindquarters than there was in the forelimb lameness. So keep that in mind. At faster speed now. Watch this through. Down hard on the left hind. Push up. Elevation of the hips to the left. Going across. And of course, this means that one phase of the stride, the anterior posterior phase on this limb, will be modified. It'll be short. And they compensate by increasing the length of the stride on the other end of it. phase stride of the other limb. You see there, the anterior phase is longer on that limb than on the unsound one. Compare this distance now. Let's see what it looks like with the other one. Yeah, they're quite similar in this particular case, but that's the way they can be compared. There's somewhat less distance on the anterior phase than there is with this leg, but not enough for comparative changes here. This, in spavin, bone spavin, the anterior phase is considerably changed. This horse has a change in the fetlock joint. Now, another principle I want to demonstrate is the fact that you can confuse a hind limb lameness with a forelimb lameness. And that will be the forelimb on the same side as the hind leg. In other words, this could be confused with, if you were looking only at the front quarters, with a right front limb lameness. Now let's watch why. Now remember, the horse travels in diagonals. You see the right hind and the left fore go together. So you'll have his head and body up to some degree when those land, and he'll come down hard on the right fore and the left hind. See the body settle there. Now let's watch that with that in mind with a little faster sequence. See how he drops in now. I'm going to back that up. I want you to watch how he lands hard on this right fore. Get the impression that that left forelimb was lame. Just watch the front quarters now, not the hind quarters at all. Looks as though he might be sore on that one, on that right front. Now he drops hard on the left front. Head there, and body goes down slightly. Normal sequence. Now let's watch it with that in mind now, that this could, just look at the forelimbs. Now we have it reversed. See, it appears that this left front could be lame, landing hard in the right front and the left hind, which are the sound limbs. Up, and we'll do it again. Now I settle down, up on the unsound hind and left front, down on the right front and left hind. slight change there. If you watched only that, you get confused with a forelimb lameness. Now, this pass, we'll watch the elevation of the hips, which is a clue that it's a hind limb that is lame. Elevation of the hips, which is not present in a forelimb lameness. Settle down on the sound one, hips up, push up, and now down again on the unsound, or on the sound leg. Push up to allow passage of the unsound leg, and down. Now, another thing we want to watch is the path of the foot. And to see the path of the foot is as you watch the anterior-posterior path of it. And in this particular case, the horse has a tendency to interfere in those front feet. They're a little obscured, but you can see how this front foot is turning in, and it comes close to the fetlock, can hit the fetlock, produce fractures. They can come up higher and hit the splint bones, cause fracture of the splint bones. And this is forelimb interference. You can see there, if you watch closely, there is a very definite tendency to interfere. It's difficult to get this view on camera because the horse must have a straight line away from you. But I think you can get the idea from this view. Now watch the horse. As he comes towards you, he does do some twisting and turning here, but watch those feet turn and go toward each other. Now the horse will turn toward us here. We'll slow it down. Right there is where interference can occur. Right there. There's a good view there of the angle, how the foot is turned in. And this is a base narrow toe out position horse. That's the basic conformation fault that allows this to happen. There's a good view as that foot comes by. Now watch it here. Right there. See how close that is to the fetlock. See how the foot is angled inwards and would tend to cause interference. Now other things, you want to look at all parts of the conformation of the horse. Here are the hocks on another horse with bog spavin. Swelling here on the anterior medial surface of the hock joint. Swelling back here. This is a continuity with the tibiotarsal joint capsule, not therapin, which is higher up in here. This is bog spavin, and in this particular horse it's due to a conformational difficulty, too straight a hind limb. And when they are conformational in origin, there's very little you can do about it. This is part of your overall appraisal of the animal. Now these straight hind limbs predisposed to upward fixation of the patella here, and they stress the anterior part of the capsule and can be a factor in bog spavin. So the appraisal of this horse is he's too straight in the hind legs, and those conditions certainly can occur. Now other things you want to look for are muscular atrophy, This particular horse is a Sweeney, or paralysis of the suprascapular nerve. And as the horse comes toward you, watch the rotation of that shoulder outwards. This is from the loss of the support of the supraspinatus and infraspinatus muscles. Now as he comes toward you, watch the rotation of the shoulder outward. Show it at a more normal sequence. I'll turn here and give you a better view in a moment. Start here. Watch the shoulder. Watch the shoulder rotate outwards. We have atrophy here. There. See the shoulder? It's protruded this way, come outwards. Back it up once more. Now watch him in a more normal sequence. Watch the shoulder roll outwards. And although it's not too obvious on this view, there is a considerable atrophy here, the supraspinatus here, and the infraspinatus in here. And the spine of the tibia is easily palpable in here. So look for muscular atrophy in this examination. Now, I think we can see this now in good shape. Here we have a sequence showing the way to pick up a foot on a horse. There are two ways to pick up the foot on the horse. One is to push on his shoulder, force his weight to the other limb, and go down with your hand on the front of the limb, letting him feel your hand coming, and then pick up the foot. Let it sit there a minute before you take it between your legs, so he gets used to the control. And take it between your legs, and keep it in a comfortable position for the horse, or he will resist. Now the other way is here. Is come down the back of the limb with your hand, letting him feel your hand come to pick it up. Now, you should have your assistant stand on your side, so that if there's a trouble with the horse, you can turn the horse toward you and turn the hind limbs away from you. Now, a horse can reach up and kick with his hind foot. You should keep this in mind. From this position, he could hit you on the back of the head. From the other position, he could hit you in the middle of the back. So you're not completely safe at any rate, but you should evaluate the horse and have some idea of his temperament before you do these procedures. But do keep in mind that you keep your own safety in mind. You must keep the foot in a fairly comfortable position for the horse. Now on the hind limb, here is your anchor point for safety, the tubercocci. And that is your push-off point, so that if you're in trouble, you can push at this point and get yourself away from the horse, and that will be demonstrated on this sequence. Go down the outside of the limb. I'm going to reverse that so you see it again. Go down let that horse feel you coming with his hand. Slide down the back of that limb so that he won't resist as much. Don't just go up and grab the hind leg, or you're liable to get kicked. So anchor your hand firmly, slide down the back of the limb, get into the pastern area, pull a limb up, and then I change my hand there to the toe. That gives you better control. Let it set there for just a moment, and he'll show you where he wants the leg. You must get in an awkward position to make that horse comfortable. If you pull the limb too far laterally or pull it too far in back, he's going to resist you. So let him be comfortable. And if you let that limb set for just a moment, reverse this and show the spot I'm talking about. Right there, with the hand on the outside of the toe to hold it in position. Then you can move into position, and he will pretty well usually keep the leg there. Now if you get into trouble, the horse is getting away from you, bring that arm back, your inside arm, to get to the tubercocci, right here. Push yourself back. Do not let the horse, if possible, get you behind him. Get you, the arm around. Let's reverse that once more. Bring your inside arm up high over the body as quickly as possible, holding onto the toe with the other hand if possible. Get your hand on the tubercocci and push yourself backwards and stay close to the horse. And the handler should at that time be turning the head of the horse toward you to throw those hindquarters away from you. Now we go to the overall appraisal of the limbs. Let your eyes look for swellings. Look for abnormalities. Go over both limbs. Don't overlook something. Do a lot of palpating. Use the back of your hand to check for heat changes, because the palm is not as sensitive to heat change as is the back of the hand. Go over the limbs very well with palpation. Then appraise again. Now we examine the carpus. We feel for swellings, abnormal changes, and then we can flex the carpus. We can identify the intercarpal joint right up there under the thumb and forefinger with the extensor carpi radialis between the thumb and forefinger. We can enlarge that view a little bit so we can see it a little better. This is the intercarpal joint, the radiocarpal joint there, and the extensor carpi identified. You cannot feel the carpal metacarpal joint because it does not open. Now we can look here at a close view at the conformation. This horse is quite upright on the pasterns. And now we can palpate carefully, identify the suspensory ligament and the volar pouch right there between the suspensory ligament and the third metacarpal bone. That's if there's swelling of that pouch, that's important. Maybe there's a change in the sesamoid bone or arthritis or a chip fracture of the first phalanx. And here is where the location of the tendon sheath is. The finger is on the deep flexor tendon, and so the tendon sheath is between the deep flexor and the suspensory ligament, which lies just ahead. Suspensory ligament lying right in here. So the volar pouch is anterior or cranial to or dorsal to the suspensory ligament, and the tendon sheath is between the suspensory ligament and the deep flexor here. And those are important points, although both of them may be involved in lameness. Palpate the tendons behind the suspensory ligament. This demonstrates the area where traumatic arthritis or so-called oscillets may occur, be demonstrated by swelling of the fibrous part of the capsule in this area. Area of where ring bone, high ring bone would occur. This is the proximate area of the pastern joint. ring bone in this area. It will be demonstrated by swelling. Perhaps there's a fracture of the extensor process, or a ring bone will demonstrate some changes right in this area. Palpation back here of the collateral cartilages. You can see the cartilages compressed under the thumb. Check for softness for side bone. Compare one leg to another. Palpation on the anterior surface of the leg for so-called shin buck or periostitis of the third metacarpal bone. Palpation of the splints now, the lateral splint here. Feel the groove between them. And then the medial splint. Feel that groove. See if there's any sign of splints or reaction between the third and second metacarpal bones. Now, a very important part of the examination, of course, and it should be done routinely, is examination of the foot. This must be thorough in every respect. And first we start by cleaning out the foot so we can look at all of the different areas. Clean out the debris. Use a good, this is called a hoof pick. Then use your knife to do some trimming to clean the sole off. Don't take off too much, but take off enough so you can see discolorations of the sole. Clean out the sulci of the frog. Trim away abnormal portions of the frog that don't belong there. Don't take away too much, of course, but all the dead portions that interfere with your examination. Nail punctures can be difficult to find, although your hoof tester will localize them quite closely usually. Examine that white line very closely. Look for so-called a seedy toe or an abnormal formation of the white line from separation and old laminitis. Look for so-called gravel where there's been an infection from the white line going on up and draining at the coronary band. Changes that go deep in that white line, we take our knife and investigate, see if a pus comes out. So check it very thoroughly. Sulci of the frog. Now the hoof tester exam, cover all parts of that foot. A good hoof tester is a very important piece of equipment. Check all parts of the foot. You can localize sensitive portions to within a very small area. Now checking for navicular disease, the medial 1/3 of the frog to the lateral wall, and in the center 1/3 of that frog is a sensitive portion. This is the test for navicular disease. This horse is flinching somewhat. This test over the heels is not a real good test because most horses will flinch to it. There's the test for navicular disease, frog to wall. Now, this demonstrates picking up the foot in front. This is the position we usually use to take our rasp or a clinch cutter to remove the clinches on a shoe for removal. You can do the same thing with the hind limb. Pull that limb up forward and put it on your thigh. And although the sequence here is short, you can see how it's transferred so you can work on the other side of the foot. Take it around behind. And set it on your thigh there. Now, examination of the hind quarters. We want to be sure and go along the back, palpate along the back, look for atrophy in the hind quarters, look for a fracture of the tuber cocci, look for atrophy in the quadriceps. So we study the animal from behind as well as from the side, but examine all of these areas and then palpate and examine the rest of the limb closely. In the area here of calf talk could be, palpate the flexor tendons. Examination of the foot up to the hock in the hind limb, from here to here, is very similar to the forelimb. The same procedures are used as far as nerve blocks, hoof testing, and so on. Again, palpation is very important to detect abnormal areas. Now here's a very important examination. That's the examination of the femoral patellar pouch, palpation of that pouch between the patellar ligaments to detect distension. If this pouch is distended, there's trouble. So this is a very important examination. Compare one with the other. It could indicate patellar problems, it could indicate meniscal problems or ligamentous tear. But it is an important change if it's present. Check here on the hock, look on the inside for changes of bone spavin. Achilles tendon there, capped hock area. Now in the rest of the limb. Now most changes in the hind limb are going to occur in the hock or the stifle. Now this is called the spavin test. And you hold the limb cramped like this for 1 to 2 minutes, and if the animal shows increased lameness, especially a markedly increased lameness, this may indicate bone spavin. It's not specific and not 100%. It may also indicate changes in the stifle joint. But that's the way the spavin test is done. Now here's a horse with bone spavin. You can see the changes, the swellings here, indicating an abnormal hock joint, right in here. So this is your visual observation, something you should pick up almost immediately on looking at the horse. Now we're going to check the medial collateral ligament of the stifle joint. Notice that the arm next to the horse comes around and it's around the hands over the inside of the hock. You push in with your shoulder, you pull out with this hand to try to open the joint. And this hand is around on the medial aspect of the joint to see if that joint opens up. So watch this sequence closely. Push into the shoulder, out with the hand next to the horse, and palpate with the right hand in this case, and any opening of that joint indicates that there is a loosening or tearing of that medial collateral ligament of the joint. Here we're checking the other side, the same technique. In with the shoulder, out with the hand, and palpate with the other hand. Let's check for medial collateral ligament damage. Now to check for anterior cruciate ligament damage, we lock our hands around the top of the tibia. We put our knee behind the point of the hock, jerking quickly in this direction, caudally, and if we feel any crepitation, either on the backward pull or the release forward, we know that there's damage to the anterior and possibly posterior cruciate ligaments. And there will also be meniscal damage as a result. And that's how those tests are made. Looking around the hock, here on the inside, checking the spavin area, the area of Kinnean tendon. Right here is where the course of the Kinnean tendon is, about the center 1/3 of the chestnut is where it inserts on the tarsal bone, on the first and second tarsal bone. Area of bone spavin. Looking at those hocks, a good close examination. Check everything thoroughly. This is capped hock area, and that's the area there of curb. So be sure you've given everything a thorough visual and palpation examination. And of course, you cannot be too complete in your exam, Do not overlook the possibility, as I've mentioned, that something else may be wrong with the horse besides the lesion you're looking at. And the only way you can escape embarrassment is to give that horse a very complete examination. This completes the tape on examination of the lame horse.